First of all, good afternoon, and thank you for joining us. I'm Carolina Albernas, Director of Business Development Operations at the Brazil-Canada Chamber of Commerce, and we're here today to talk about the future of healthcare. Just as a few housekeeping rules, so after the presentation, we will have a Q&A session with the panelists. So if you have any questions during the webinar, please type them on the Q&A box and we will answer them at the end. So just as a start, for those who are not familiar with the BCCC, for over 47 years, we've been building relationships between Brazil and Canada, strengthening the bilateral relationship in investment, trade, best practice, and in mutual growth and prosperity. Our relationships are private and public, featuring managing directors and decision makers of small, large, and very large companies and institutions. Our volunteer board of directors has expertise, knowledge, and connections that can only be found by being active players in the Brazil-Canada market. As a membership-based association, we support our members through mainly 3 points: advocacy and government access, so uniquely placed to gain access and learn insights with governments in both countries; qualified information and insights, what means that our research and connections can identify future trends and qualify rumors to ensure the intel you get is correct and timely; and thirdly, connectivity. So our network is unparalleled with access to universities, not-for-profits, C-suite executives, entrepreneurs, everyone conducting business between Brazil and Canada. So as an example of our activities, we've, since 2018, organized more than 50 events in 10 different sectors with over 1,500 attendees, and established over 10 new partnerships and supported many trade missions with a total of 70 companies looking either to establish themselves in Brazil or Canada and connect with clients and suppliers. So if you want to learn a little bit more about the BCCC and how we can help, please contact me. So without further ado, the world, as we all know, is in the middle of a pandemic and a global economic crisis that is challenging all aspects of life as we know it. So social distancing, online learning, working from home, we all sort of lost our sense of normal and are already adapting to new habits and to a new reality, as nobody really knows quite yet what the future holds in terms of social lives for us right now. The COVID-19 crisis is forcing most industries to disrupt and is catalyzing and accelerating the long anticipated digital transformation. And of course, with healthcare is no different. So the transformation of healthcare that we've all been hearing for the last few months. Telemedicine and digital health have been around for a while, and the pandemic made the healthcare industry and the regulators rapidly realize that the applications need to be adopted in a much larger scale. So hospital and the healthcare system worldwide need to upgrade in every level, from infrastructure, processes, as they need to ensure a better and safe environment to medical staff and patients. So the mindset's changing. We know that there's a lot of new tools and technology that are coming with it: artificial intelligence, digital health, apps linked to wearables, cloud EMR, faster diagnosis, genome sequencing, robots reading patients, the list goes on and on. So though certain legal and regulatory changes remain, the outbreak might be the right incentive for lawmakers and regulatory agencies to promulgate further measures and facilitate more widespread adoption of telemedicine. And we're here today with Dr. Andre Schneider, MD, anesthesiologist at Charlotte Regional Hospital in Bathurst, New Brunswick, one of the most important hospitals in that province. Dr. Omar Basha, MD, PhD, gynecologist, oncologist at CHUM, the center, my French is really bad, so Centre Hospitalier, University of Montreal, and professor at the University of Montreal. And Raquel Boixá, CMO at Atmos Healthcare Platform, member of our healthcare committee, startup committee, to talk a little bit about the importance of telemedicine, the adoption large scale, role of hardware and software applications, as well as the future of collaborations in the healthcare industry. So welcome, and thank you for being here today. So I would like to start with our panelists introducing themselves. So if Raquel, if you wanted to start introducing yourself for our audience, please.
Thank you so much, Carolina. Thank you so much for the invitation to be here in this webinar. I see a lot of people that I already know here with joining today's. I will introduce myself and explain a little bit about Atmos. I am the Chief Marketing Officer of the company, and I moved to Toronto last year to launch our electronic medical record here in the Canadian market and lead our research and development team to be on the cutting edge of innovation in healthcare. Atmos is a cloud-based platform that consolidates the whole clinical patient information in an easy-to-use software for physicians, clinics, and small hospitals. It integrates different areas and other suppliers to clarify all patient clinical information and help physicians to make agile decisions based in safe and complete data about the patient, the best practice protocols and alerts. At Atmos, the healthcare professionals can see images, blood exams, patient documents, prescribed medication, schedule consultations and procedures. We have been based in Brazil for more than 10 years, where we have more than 10,000 users in hospitals and multidisciplinary clinics. What we can say is that using Atmos, the physicians can reduce more than 70% the time filling reports. Last month, we started to implement for the first time completely virtually our electronic health record in a hospital in São Paulo. All the meetings and integrations will be made online. The goal is to finish all the implementation in 2 months and train 800 health professionals in 2 weeks. It's for us a record, and we see that with this pandemic, it will be a very important tendency to have a security effort to implement and be faster and secure in all the environment. Here in Canada, we spent the last year in research and development to adapt our solution for the Canadian market, where we have been supported by the accelerated Latin startups, Seneca Helix, and Venture Lab IBM with infrastructure, mentoring sessions, and networking. During this pandemic, we launched a specific feature for mental health professionals for online patient care. The new resource is available on our website, and mental health professionals only have to register to create a free professional account and meet their patients in a private online visit room. When we talk about future of healthcare, I see a huge importance of global collaboration in research, technology, and international health protocols. The healthcare sector must be cautious when you talk about disruption to be sure that all the decisions are safe for patients and guided to reduce risks and increase time for patient care. At the same time, this pandemic accelerated the need to use technology and innovation to develop new tools and new ways to communicate and support patients. I'm very glad to be part of this discussion and bring some insights about the future.
Thank you, Raquel. I would like to then ask Dr. Schneider, André Schneider, to introduce himself as well, and please.
So my name is André. I came from Brazil 7 years ago. Me and my family, we ended up being in 3 different cities during this time. Kingston, Ontario was the first hospital, Kingston General Hospital. After that, we moved to Mount Sinai. During this time, I was doing fellowships when I was invited to come to meet my hospital now, where I work for 4 years. In my specialty is anesthesia, but because of my background in chronic pain, that's why I was invited to be here. So nowadays I work with anesthesia. I have a clinic of chronic pain inside the hospital, and the secondary clinic is not a tertiary environment, but we can make a very good job here in this small province. Other than that, what I can tell you guys, I'm very lucky where we are, because my province doesn't have so many issues with the COVID. And even my hospital, it wasn't very involved with all this. We only stopped to work and organize things to receive patients. But New Orleans, as everybody can see, we didn't have so many patients, so only 120. None of them end up dying. and maybe we have 2 cases, I think, only that's still in situation of infection of COVID. The rest of them, they all got immunization, and apparently they are cured.
That's amazing. Thank you, Andre. So Dr. Omar Basha, if you'd like to introduce yourself as well, talk a little bit about your experience.
Of course. First of all, my pleasure to be here. Thank you for the invitation. I'm a gynecology oncologist. I've been in Canada since 2008, and I'm always in the French province. I'm in Quebec. I was training in Quebec City, and after I came to Montreal, where I have worked for 7 years at Charlemagne Hospital, University of Sherbrooke. And now since September 2019, I'm in CHUM, the Centre Hospitalier de l'Université de Montréal. I'm also AMD and PhD. And with this COVID crisis, unlike Andre, Montreal is the main spot of Canada. We have we know that we have like 1% of Montrealers infected, but probably it is like 10 times more. So we have a lot of people. And that's why I'm here. At CHUM, we began to use a lot of telehealth, telemedicine. And I'm surprised, and I'm talking to you about it. I'm really surprised about the results. And at the beginning, I was like uncomfortable, but now I like a lot, and many patients too. And so we're gonna discuss about it. Thank you.
That's great. Yeah, no, it's for sure. It's also a little bit of adaptation as well, and you're talking about it a little bit further. So we have here too, when it comes to like the medical experience in terms of the doctors, we have here too very unique experience in the front line. So Dr. Basha at CHUM, Montreal is one of the most affected cities in Canada, and also Andre in New Brunswick, one of the provinces that was the least affected by COVID in Canada. So for many years, we've been talking about how the internet and the telemedicine will help patients in remote areas, reduce cost of public health, but it hasn't really taken off. I don't think that's about the comfortable. People weren't really comfortable, it hasn't really taken off into the pandemic. So why is that? And what do we need to really do to increase the adoption, not only by doctors, but to make sure that patients feel comfortable with that possibility as well? Like, so if you'd like to start, Omar.
Okay, so Carolina, what's is happening? It's a revolution in Canada. I know some cities of the United States, like South Carolina, they have been using it, and Mayo Clinic and other places for some time, but COVID crisis really has accelerated this. So for many years, I've been working here and listening to patients that are coming 100 kilometers away and 2 hours from their home, and they stay with me sometimes 5, 10, 20 minutes perhaps. Well, first case perhaps 30, 45 minutes, okay, but sometimes it's just a revision. And what's happening now is that we're talking to patients, and we're asking them how they are, and then their symptoms, and how they are feeling. And we can do this revision with them, and even first consultations we're doing online too, or by telephone. And this is a topic that we have to solve, because online is not so good yet. We have some troubles with like connection sometimes. So many times they're using telephone yet, but I think we'll like change it, and probably in the future. But by now we're doing like both, but most telephone, and it's really good. The patients, they like it. Most of them, they like it. And sometimes we have to examine them, and they come. But many times what's happening is that I'm talking to their doctors at their region and ask to the doctors what they have seen, and doctors have already examined the patients there. So I just don't need to examine the patients, and I'm going to just know the patient before the surgery. But they are accepting very well, I could say.
So the access to like specialists like that are not local. What about you, Andre? Like, what's your perspective on what do we need to do to increase the adoption of telemedicine by doctors and patients?
Well, I believe the big first barrier that we need to pass through is going to be the doctors, the hospitals, and the nurse staff team, because I'm working in a place where patients like Omar come from 2 hours, 3 hours from here just to see me in the pain clinic, right? We don't have so many doctors working with that here. We have maybe 8 or 9 doctors in our province to take care of 700,000 patients. So when you think this way, a lot of our connections before the COVID crisis were directly to the family physicians that were seeing the patients. And we just guide them and teach them how to deal with the situation. And when they can't handle anymore, they send the patient to the clinic, just to avoid this transportation and the difficult burden for the patient to pass through 3 hours on the road, coming back, and all these things, right? With the COVID situation, what we're organizing now, it's a little bit different and challenging for everybody, because a lot of things that I need to do are connected with physical examination, injections, and nerve blocks. And it's all dependent on my presence to do that. But once the patient is well out of the crisis, we can really manage them only with medications, and maybe they don't need my hands anymore. So it's where I'm going now with the discussion with the nurse staff. Probably we're going to come back with the clinic to run continuously again next, I think in 2 weeks, that's the idea. But everything's going to change. Like all the patients that only manage the medication now, are going to do by interview by phone or by internet consultation, Skype, and other way that the patient can contact us. But the rest of things that I do, the patients really need to come by. We don't have the chance nowadays to deal with that. Maybe the telemedicine in the future is going to be ready for that or not, but that's dependent of training and skills of the nurse that's going to be there with the patient or the family physician to be able to deal with what we want to teach them and learn by our guidance. Basically, that's what I think where we are going from now. And with the 5G technology, that maybe change a lot, the speed and the way the communication go through the cable and internet faster and more real time, maybe it's going to be a huge jumping for us.
Got it. So it's mostly like understanding exactly what can be done by telemedicine, and I mean what should be done and what should not and cannot be done by telemedicine. So maybe like initial assessments, access and connection between family doctors and specialists. Do you have anything to add, Raquel?
I agree with Andre and Omar about all the situation here in Canada. What I think telemedicine can bring is content from specialist doctors to remote low access areas. Andrea told me before that sometimes he needs to engage other specialists in the same area and they are far away. So I believe that telemedicine can also help to spread knowledge and information in difficult access areas. I could give also emphasis in the adoption of remote technologies like cloud-based softwares and teams to data security. Hospitals, healthcare professionals must be worried with their patient care. So what we see in remote areas is that technology can help physicians to access information, global protocols, new tools, and online resources to help them to make their own decisions.
Got it. So, I mean, we know that in Canada, telemedicine was something a little bit more widespread than in Brazil, for example, with like telehealth, like playing a big role on answering some questions, people trying to avoid people to run to emergency rooms unnecessarily, even before the pandemic. And the pandemic, of course, has like COVID has accelerated and has speed up a little bit the implementation of telemedicine. So we know that when we implement something in kind of a rush and it's not quite ready, we face a lot of issues that could catch up in the future. So talking a little bit about how it was being used, how it's being used right now, and how we expect it to be used in the future. What do you see as the biggest bottlenecks in telemedicine that needs to be urgently resolved? So Dr. Omar, if you like, what are the issues? What do we have to do to improve?
So one of the aspects it's the time of the consultation, because sometimes you are at this time with COVID, patients are usually at home, so it's easy to find them. But I think it's gonna be a problem, or could be a problem in the future. So because sometimes you can think, oh, it's really easier for the doctor to do a teleconsultation than with the patients. No, it's in my opinion, it's the opposite. It's just hard because I'm not used to it. It's a tool that we're learning, and sometimes it takes time. So this is a point, and patients should be there, and you should be there on time, or at least try to respect that time. So this could be a point. Another issue, it's like I told you before, it's connection. And now we are using a lot of telephone, but I think we should go on internet. But for this, the connections should be better than they are now. Sometimes we have some troubles with connections. So a third issue is that you have to use like security systems for telemedicine, and you have to write it. And mainly when you use like internet, you cannot use an open site to do it. So there are some tools that are being developed with security because of confidentiality. So it's very important that these tools be present, mainly when you're going to use like internet. Because when you're using telephone and you are writing or dictating your consultation after, there's really not a problem. But when you use internet, you're going to need a secure connection. Otherwise, you can have confidentiality problems.
Got it. Andrea, do you have anything to add?
Yes, one thing I'd like to add is, I don't know how they're doing in Montreal or Quebec in general, but the New Brunswick Med Society set up a special space with a Zoom, okay, just saying a platform, and where the doctors can use this platform through the system of New Brunswick Med Society, and it's going to be full sealed operated. That's what they said. And they set up everything during this time of COVID. Okay, so I believe it's that way, this approach with when you work together with society is better, and they help you to protect your information, patient informations, and everything. I see more like a big issue, a big problem for us is going to be the implementation of the rules that we don't have yet. That's a big, big problem, not only here, but also in Brazil, because we're developing rules in connection with developing tools to be able to work with this technology. So all this should be done before the implementation, but now we're doing everything together. And the way things are going are too fast. Maybe at some point, or the doctors or the patients going to have a little bit of prejudice, but that's a part of implementation, things so fast, as you told before. That's my opinion.
Yeah, no, for sure. I think that broadband and connection is definitely like a big issue, not only in Canada, but I think all over the world, although today I think internet's much more spread. Still, there are some regions where it's that, especially, I mean, more in Canada, more in Brazil, it's like not as spread as here. And then, of course, rules and regulations. We know that, for example, there's a lot of still skepticism about privacy and confidentiality. And I think that there's a lot of companies working now to solve those issues as fast as possible. Raquel, do you have anything to add to that in terms of bottlenecks and
yes, I think
like
so.
on the technology
Well,
side?
there are many challenges to be solved, and I agree with Omar and Andrea about all regulations and confidentiality and technology that we must improve. With my knowledge, one of the bottlenecks is the majority part of the patient clinical history data, at least in Brazil, is not stored as a structured information. I can explain better. This is very serious because if it was complete, we could use artificial intelligence to analyze side effects of common medication, similar genomes characteristics, evaluation treatments. It would allow people to see how they fit in a big picture, increasing efficiency and maintains a balance in the practice, even in difficult access areas or developing countries. This is a complex information, but if it was accessed in a structured way, we could use that with artificial intelligence to develop new research. This is a big bottleneck in technology.
Great. So since we're talking about technology, I'm gonna stay with Raquel here. And since this is her specialty, what like with the broadband applications, all we're talking about, so what is the role that hardware and software developments, what is the role of hardware and software developments in supporting and improving telemedicine? And since I'm gonna add something else to that question, since you are, Atmos is part of Encore, the 5G labs at Mars in Toronto, so how will 5G, as Andrea mentioned, change the way we receive care? Okay,
I will tell about the first part because it's very complex. Yeah, well, improving quality of life is one of the main benefits of integrating new innovations into medicine. This is the most important part. Medical technology, like minimally invasive surgeries, better monitoring systems, or more scanning equipment, are allowing patients to spend less time in recovery and more time enjoying a healthy life. Technology must move forward, always looking for healthcare needs, for a better and faster way to save more lives. With technology, we might provide more time with quality of life for patients. Improving telemedicine, we can use our medical resources in a larger field, save more lives, and financial resources. If we talk about hardware, robots, for example, can help families to be closer during patients' treatments with contagious diseases. Telemedicine robots in hospitals, for example, now during this pandemic, they were used for consulting specialists and visit family members in social isolation. I saw that experience in Brazil, in the south of Brazil, in Moinhos Vento Hospital. And for me, it's one of the benchmark experience if you think about social isolation in this pandemic. About the 5G, well, I will explain about 5G technology because some of the people that are here with us don't know it. It's a lower latency and higher capacity, so the healthcare system can offer remote monitoring for patient care. It's a new technology here in Canada. It's going to be offered in 2022. I think one of the advantages is to provide information in a higher speed, and and a greater speed for the transmission and a greater capacity to remote execution. Atmos is developing a research at Mars Innovation Center in the 5G testbed access, because here we don't have public access yet. So the project is going to be finished in 2022. It is aimed to develop a technology that uses electronic medical records to superimpose patients' medical conditions onto their personalized 3D dimensions. So in the future, the idea is to project holograms using 5G. So can you imagine, for example, if you want to see an evolution in cancer disease, or if you want to see any problems in your skin in a dermatology consultation, or you have to exchange information with other doctor that is in a difficult access area. So you can use 5G to project these 3D dimensions and show the images in that way. That's the project, that's the idea.
Yeah, the whole hologram thing for me is mind-blowing. So Andre and Omar, do you from the doctor perspective, how do you expect hardware and software and 5G and holograms to improve the way that you provide care to your patients?
Well, I can talk first, if Andre don't mind. So one of the things we could do, and we began to do the past, there are some experience on the world, and it's like surgeries, like robotic surgeries, even if you are in another place, in another city, and you could perform the surgery of these patients at the distance. So it's a possibility. Other possibilities are to talk telehealth, and yeah, things are evolving very fast. It's gonna be amazing to see what's gonna happen. You can monitoring blood pressure of your patients all the time with some tools that are being developed too. So these things are happening, and we're gonna see this much more frequently.
Andre, anything to add?
Yeah, I have seen a lot of research about these things, and as Omar said, I saw a very nice research discuss about the robot technology to use a distance with if you have a very good line or conduction of image and internet at real time, you could really do surgeries remotely. Like Omar is in Montreal now. I have a patient with ovarian tumor here. My gyne specialist is not perfect throughout training in resection lymph nodes around some specific areas, and he is, so he could really help him to do the surgery. In the case over here, guided by internet, images, and even by robot surgery. It's a very, very interesting point of view, and we have seen that discussion, and I think already they have some experience with that trying around the world, and I believe Canada is one of them that's trying to go through that system too. Other thing that I'd like to say and add maybe is going to be another point of view in all this. It's going to be very helpful for the doctors to really help in other doctors, in more remote distance, family physician as much as possible, right? Because they can really reach us at distance in real times, and you see the patient together, and even guide them through the same image that they show you by the ultrasound in your side, putting the needle in the right place, just show things for them to do right away, and you solve the patient problems. That's going to really drop the price of medicine. Maybe that's going to change the medicine at all for the future. I could be working from home from now, 2 or 3 days a week. It's going to be crazy. That's the way I see things in the future.
Just add something, Carolina.
Yeah, of course.
Yes, and this should solve a huge problem with the waiting lines that you have now in Canada, and even in Brazil. you could have, there are some distance places in Brazil where patients are hardly gonna see a doctor, a family doctor, and they could have a specialist in the big centers of Brazil at the same time. I think it's huge. The possibilities are huge.
So I'm gonna take this like little conversation. So are we talking about the robotic surgery, access to specialists in different locations, virtual reality, maybe holograms, all of that? Can we assume that telemedicine has the potential to truly equalize public health? Because we talk about public health, for example, in a country like Canada, where is universal health, you don't really have private options and everybody goes into the same line. But we know that, for example, maybe someone that is in Yukon or in Yellowknife maybe doesn't have the same access to specialists and research like we do in downtown Toronto, for example. Can telemedicine solve that problem and give someone in, I don't know, Labrador access to a researcher and a specialist in Toronto? Is that what we're going to for, like, Omar, Andre, Raquel, like?
I did a research. It's not 2 years ago. It's not exactly telemedicine, but you can use this. You know, in gynecology, you use like colposcopy. And colposcopy, the patient has to come to see the doctor, and he does an exam. And with like it's not a microscope, but a colposcope, a kind of microscope, you're gonna see the cervix of these patients. Okay, so we did this study, and we take pictures, and it was a study with more than 200 patients that we published it. And we take pictures, and we compare with some specialists in distance, and we send them only the pictures. And the pictures were better than in relation with the final biopsy. They had a better correlation than with the doctors that saw the patients on the table. And this is interesting because sometimes with images and with time, and when you are not sometimes with the stress of the situation, we can help patients even more. So yes, for Labrador, for other provinces that you have, or the north of Canada, they're gonna have this like specialists, and they're gonna have these options in the big center. So I think it's a huge opportunity.
Yes, I see, Carolina, that maybe this moment is changing some paradigms that we are passing through in medicine. But at the same time, I think the pandemic accelerated process that were important to making telemedicine, and that we have been a lot of resistance before, not only for caution, but also because all of us have to leave out our comfort zone. This is not an easy step. I can give an example for mental health professionals. They were very concerned to meet their patients in a virtual consultation, and they have a lot of reasonable reasons for that, because more than 70% in what we communicate is not in words, and is with our body language and how we show our information. It's not only the sound of our voice. So they must also assure privacy and confidentiality. But at the same time, they didn't have a choice now, because they couldn't be together with the patient. I think in the future, they will use this experience if the patient, for example, is in an unusual situation and is traveling or is sick at home and need the specialist to talk to him. I think I'm quite sure that they will give a step back to review and see what was good, what was not good in this experience. And they will implement a virtual environment, a better one, and use it when it's needed. So I think the pandemic helped us to show that this is possible, but some of the specialties are going to do a step back, review what they learned, what is possible, what is not good, and use the better experience to really implement a better solution to help patients.
With a much more open mind, I assume, right?
Yes, because it's very difficult to change. I think for all the areas we live in a comfort zone, it's very hard, and with doctors it's much harder because they must be cautious. They are living with lives.
Of course, Andrea.
And I'd like to add on that there's another thing that people don't discuss about it, because sometimes they're shy to say it, but there is another burden for the doctors on all this. Remember that we all here, when you're working a patient, and also anywhere in the world, you have a huge legal responsibility. And how it's going to work on that when you do something or get misconducted guided by what you see the patient without examination of the patient? You know what I mean? So you will see the patient, okay, but you're not doing the examination, the real medical approach, auscultation, and everything. So we really need to develop wearables or other things, accessories, to really guide us and help us in this consultation. We don't have that right now. Other thing that we need to say that's very important, all the provinces, I believe, they have to release a special numbers for us to be paid when you get a consultation done by telephone right now. How is going to be working that when you do by the internet in the future? Because over here, we are not on salary, we are paid by service, right? So how is going to be that in the future? We don't have this yet. So imagine how crazy it is for us to adapt in the new technology, burden together the nonsense of be in risk to get problems with legal problems, because you're not seeing the patient as better as in contact directly with the patient. And together that, the idea that maybe you're not going to be paid as before, maybe your life is going to be as before. Because once you have this technology, you're going to be working 24 hours a day, because everybody's going to assess you if you're online. You know what I mean? So how is going to be organizing that, your family time, your kids, and all this 24 hours telemedicine work? So it's a very, very challenging time for us too.
Yeah, there's definitely a lot of regulations that need to be defined. And I think that the pandemic, it's probably like kind of like giving everyone a glimpse of the future so they can realize what is feasible and what's not, and what has to be adapted and adjusted. And so it's definitely speeding up the process. And this is always, I think, good news for the future. So we talked a little bit about hardware and software, new technologies. Another thing that I think the pandemic brought to the healthcare industry, and that we've been seeing a lot, is in terms of collaborations between countries, between universities, between private companies. We see like open patents to produce, like companies opening patents to produce ventilators. A lot of collaborations in terms of producing and developing vaccines, medications, and the whole world really coming together for the sake of global public health and how we're going to get out of this, everybody together. So do you believe that this mindset of collaborations for research and exchanging patents, all of this, do you think this is here to stay? Do you think this is something that is going to go back to how it was before? Andrea, I feel like you'd like to start, and then.
So I believe that's going to come. It's coming to stay, because the connections that people are doing now to really developing things, to really make groups or connections, to create new approach, create new ways to deal with all this. As you really developing something, you're going to stay together working with these people. And that's the way usually we end up. When you have things in common to guide us, we get together. And after that, make friends. And that's the way things are going after. So these people is going to be around with you. So I believe that it's coming to stay. The connections that we are doing between countries and between scientists and between different doctors and even doctors and patients that with new ideas is coming to stay for sure. I don't believe that's going to be break. I think it's going to stay.
Mm-hmm. Omar?
Yes, you know, I was thinking about it, and a pandemic is a kind of a war, you know, while living a period of exception. And when it's happening, it's terrible. But as other wars or other pandemics, after that, we had like a huge development and a faster development, and things came together. Even the computer came after the Second World War, and other things too, industries, and we have many examples. And yes, I think it's going to stay. And I think one example is the development of vaccines. And before you're going to have like 5 years or more for one vaccine, and now they're talking about 1 year or 1 year and a half. So it's amazing, and probably it's going to be used for other studies in the future. So we can probably gonna do like medicaments, and you're gonna do it faster than 10, 15, 20 years for development of medicament. It's, yes, I think many things are going to stay and are going just faster now as any war.
Yes, I also agree with Omar and Andrea. And I can say about connections and communication, that's my field. I believe some of the doctors and researchers didn't have contacts in other countries, and now they have. They have joined other groups in different countries, and now they are not going to break it. So they are going to maintain this contact. And I'm sure that that will help many countries to develop things together. And it's not only a position of government, but it's a position of the physicians, of the researchers that are going to connect and ask questions and spread information and help each other. I think it's in many fields we are learning that. If we think about Brazil, we are a huge country, and sometimes we just think inside our country. We don't think about exportation. We don't think about new other customers because it's a huge country. So we just believe that we can offer products from there. But now, with all the globalization and this technology to help us to communicate outside, I think it's something that is coming to stay.
And technology has no borders, right? And that I think it's definitely like a big positive on this. So, I mean, with all the tragic that COVID has brought to, like all the tragedy and like COVID has brought to the world and to Canada, to Brazil, to all the other countries, I think there is, like, we can see as a silver lining the speed of innovation and how this is going to transform the way that we see healthcare happening, and the way that we see our doctors and the way that we get treated. And I think this is always a positive. I would like to open for questions. So I'd like to first thank Andrea, Raquel, and Omar for their participation here today. We have a couple questions. So the first is, going back to the beginning of our conversation, we were mentioning about performing telephone consultations. How can you ensure first patient-doctor confidentiality? How can you assure that it's the patient-doctor confidentiality is respected when you cannot guarantee that they are the only ones listening to the conversation? And also, would be easier as visually, virtual could be easier as visually you can see the only patient is there. So especially for minors seeking medical counseling like birth control. So how can you ensure that you're only talking to your patient, nobody else?
It's a great question. I was talking to a psychiatrist 2 days ago, and he was telling me that that's a challenge because we must assure that we are in privacy and confidentiality at the moment. So I think we have to develop tools to see around and ask, are you alone? Is anybody with you? Can we guarantee that you are in a secure environment? I think this is one important point, and also a tool that can guarantee that you are in a safe environment. We are also developing, even in education, some tools to face recognition, voice recognition. Everything will help us to assure that the information is in a secure environment.
Yes, but at some point, you know, even when you are in person with someone, if someone is like recording your conversation, how do you know it? I think there is, as Andrea has told before, I think regulations have to be made. I think tools are going to be useful, but I think there is still the confidentiality between the doctor and the patient. And, you know, there's some trust that has to be between these two parts.
Have anything to add, Andrea?
Omar make a good point, saying that the trust should remain. Yes, should be. I believe it's going to be easier for the patient to understand and to see when you really see the image, not by the phone only. Because I really agree, it's hard for the patient to imagine that you are in the other line of the phone and nobody else is listening what the patient is saying to you, you know what I mean? With the image, at least he's able to see and maybe trigger his mind that is really, the doctor is really alone, only pay attention to him, and really showing that. So maybe the image is going to be a big change, and it's very helpful, I think. But still, I still think the big challenge is going to be regulations and how it's going to be to set up and make that really correct and really safe for everybody. That is a big challenge for sure.
Thank you. So another question is on, should Canadian private employers be encouraged or like receive any sort of tax incentive to offer telemedicine to employees in order to reduce their time off work for basic medical consultations? How do you see that?
Yeah, this is a
very tricky one.
This is a tricky one. It's a great question because, you know, if you see in Canada, and there are a lot of money that is lost because of people are going to doctors and people are not healthy. So I don't think they should do it. It would be not like be ethical. And I do think there should be even a regulation against it, you know, because it's just not ethical. Because someone needs a physical examination, so perhaps these patients would not like to go to the physical examination because he's gonna lose money or something like this. So they should have some time for the consultation. It has to be regulated again, but not like to give like something for their employees and stimulate it.
Right, yeah.
Not be ethical in my point of view.
Do Raquel and Andrea would like to add anything?
Oh, it's a big challenge. I agree with Omar. The technology, I think you can use it. Can use resources to connect with patient, but using a different way, like consultation guidance, systems to help patients after consultations, but not in this way.
Yeah, I think tax incentive to induce, I think it's also tricky. Andrea, anything to add?
When you see that like the employer is trying to help the patient or his like people that work with him to just avoid them to lose money, and maybe that's a good thing. But on the other hand, really, if the government just give incentives or other things, and on the other hand, the big chiefs just force the patient to come back faster, and they have results in their hands to pressure the patient is really, really hard to regulate that. I think Omar is right. It's something that maybe is not the best approach for the employer and for the employee too. I think that it should be done really by the doctors involved, because we always try to protect the patient, right? So
Yeah.
that's the basic principle for us. So if you just the employer decide to force that situation because they want to save money, I don't know. I don't see with that with good eyes for sure.
Thank you. So another question, do you think that the loss of tactical and physical presence compromises diagnostic integrity? I think Dr. Omar mentioned about like the photos of the colonoscopy, but how, like, what do you think? What's your opinion on the like, lack of physical and touch for the diagnostic?
I believe we're gonna lose one big thing that we have in medicine. All the medications that we have nowadays, and all the research that we have nowadays, it's proved that 40% of the treatments are placebo effect. So if you don't have contact with the patient, if you don't touch the patient, if you don't have this connection developed, it's going to be very, very progressive losing in terms of maybe doctor approach. It's going to be hard to deal with. Maybe with the technology, 3D and everything that we can develop, virtual touching and all this kind of thing, maybe that's going to help. But by the moment, it's hard. I have seen my patients I've been talking with them by the phone sometimes, and it definitely is not the same thing because they miss the way we are. We like Brazilian doctors, I believe we are very approachable. We touch the patients, we talk with them in the medical field different than the Canadian doctors do. And that's maybe why we have this connection too. Maybe we're gonna lose that, and that's not a good thing. So we need to develop a way to keep that thing. That's the way I see. We're gonna lose some, but maybe we're gonna gain in the other hand. So it's a big changing for us.
I agree with Andrea, and I think there is a balance on that. If you think about older people or people that are very far from their doctors, or if a cancer patient that is in a very difficult situation, sometimes some consultation could be online to help them, and just go when it's an urgency situation, and more important to be in a present situation. So if we balance that and we use the technology and online consultation for situations that you can help far away, I think it's a good point. But at the same time, the doctors here can explain better. Sometimes consultation in presence is really important to understand the health situation from the patient.
I agree with both of you, but I think we're gonna have some gains too, and Rachel and even Andre said, you can have access to some specialists faster. And one thing is that, yes, you're gonna not have the touch of the specialist, but if I have a general gynecologist, I'm a gynecologist oncologist, okay, I treat cancer. So if I have a general gynecologist that did the exam and talk with the patient and ask for my opinion, and I did the consultation with the patients, well, it's not, I agree, it's not the same thing, but at the same time, this patient's not gonna have to travel like 200 kilometers, or there are many gains too. So you always gonna gain something and lost something, and you have to put this on the balance.
So it's, to be honest, is about just like defining what kind of specialties and when telemedicine is actually should be used and when it shouldn't, right? I mean, it's all about probably not as useful for family doctors depending on the situation, but for a specialist like you, Omar, this could be a great help for patients that would probably not have access to you, to not now have access to you. So this is always a good thing, correct?
Yeah, I think it's many patients are happy now because they are having their consultations very fast. So I can see patients, well, I talk to you next week and I'm gonna talk to you in 2 weeks. And before it was, oh, doctor, I know I live in 100 kilometers from here. I cannot come next week. So I think for many, what I see is that patients are happy with the situation too, not with the COVID situation, I say with the telemedicine. They are accepting it very well.
So this is a very interesting question here too, so how can we ensure and protect and not forget those that are computer illiterate patients, like elderly, newly arrived from other countries, people don't really have access to computers. Will this, will this increase their access as a big portion of literate points? So how do you see that access to people who really don't have access to the technology? That's another tricky one. Raquel, I'll give that to you.
I think most of the people have access at least for a mobile phone now. I believe the majority part, 90% of the people has access at least a mobile phone. So the technology cannot be difficult to access. The user experience must be very easy to use. Even for doctors and physicians, sometimes when we talk about technology, they are worried that they will not adapt to use the platform, and it should be the opposite. I cannot build a technology that is going to give them more trouble. I have to build a technology that is going to help them to have more time with their patients and less time filling reports and understanding technology. The challenge for us that lead with communication and technology is to guide in a way that they can do their specialty, they can understand more about health and help their patient, and using the technologies as an assistant. And for the patient, I think the same way. It cannot be in a difficult platform that he must spend a lot of time filling reports or understanding how it works. I know a project in Brazil that is very interesting. Is a physician that works with patients with cancer disease, and she developed an app for their mobile phones that help them to remember the time to take the medicine, to send if they are feeling well that day, to give some suggestions and that advices, and see how they are step by step. This helped them to be connected even after the consultation. It's a way to be connected with the doctor in a very difficult moment of their lives. So for me, technology has to be used like that to approach and have a better approach with the patients when they are not in a consultation, and also help them to use the resources we can give in their houses. For example, information to use the medication in the best way, times, alerts, any kind of things. It cannot be something difficult to use for doctors, for healthcare professionals, and for patients.
Yeah, and we can't forget that telemedicine as well, it's not going to completely replace the physical consultation, right? It's more like an add-on to what we have, and like to improve the
So can I add a little bit of gas in the fire?
Of course, please.
So when I came to live in Canada, I have a huge discussion with a colleague of mine, because even here nowadays in my hospital, okay, they gave me a beep. I don't know if you guys remember what is beep. a
Oh,
device that
yeah.
you receive a message when somebody calls you, right? So
like a pager.
I haven't used pagers or beep for like 10 years when I moved to here, because everybody has a phone in Brazil. But in Canada, the doctors, they use these pagers to call back their hospital. Can you imagine that in Canada?
They still use fax machines for like.
Yeah, they still use fax
right?
machines. So we can say that at least maybe 30 to 40% of the Canadian population, they just turn off the phone when they go to sleep, or they even doesn't have cell phones. Can you imagine that? So in this environment, I totally agree with the difficult part to teach people to get through this. Maybe people with the timing gonna get through the system, learning all this, but it's gonna be a hard thing for the older people to get in this together. It's totally different situation for my son with 8 years old that goes in the computer like crazy than what's happening for now with my dad and my mom with 70. So it's totally different approach for sure. It's going to be very hard for them to learn. And even when they have mental issues now, and they're going to live more 10 years, maybe more 15 years with Alzheimer or Parkinson, how's going to be that? So it's really, really challenging times. And it's really challenging to adapt that for these people. And it's going to be different for country to country because of cultural issues. Brazil, to have a cell phone and with internet access now is a basic thing. Even in favelas in Brazil, we see people using cell phones with internet access. But in Canada, we see rich people that doesn't want a cell phone because the phone just make them work differently and they don't like the idea. So each country has this cultural barrier to break it, and that's going to be a new challenge for sure.
Yeah, no, in Brazil, you have probably more cell phones than people. People have 2, 3 mobile phones. And definitely in Canada, you see, especially in New Brunswick, and you're talking about like an older population, there is definitely much more resistance in terms of cell phones and computers. But I think it will catch up as well. I just, we have like, I know that we're running out of time. We still have like a couple very interesting questions here. So I will, in terms of, so talking about the infrastructure of hospitals, what kind of, in telemedicine, what kind of spaces in the healthcare facility is needed to better practice telemedicine? So would professionals be working from home? What kind of infrastructure do the hospitals need to provide doctors for telemedicine to work?
Oh, not a lot. You just need a computer and internet working and private space. So it's a small room, it's enough. No, you just don't need a lot of space to do it. And just, I would like just to add that sometimes you could for old people, just to the last question, use telephone too, you know? And I saw research that in Canada, perhaps in some regions not, but in most of Canada, you have like 86% of population with cell phones already. So it's a lot.
Yeah.
Yes. Well, about hardware and softwares, it's like Omar said, to use its own internet access and computers. And I might say that for hospitals, the technology and cloud-based are helping them to invest financial resources in other areas. Because if you think that hospitals have to have big areas with hardwares to secure data and a technical team to support all of it and make sure that everything is functioning normally, it's something that is very difficult to imagine, and they have to do it. Now, with the innovation in technology, we can do a lot of things in cloud-based platforms inside the country. Each country has its regulation and protocols, but we can use in a secure environment cloud-based. So we would reduce space with hardwares, and we could use that for patient care. So it's the opposite with technology nowadays. and innovation. We don't need too much hardware in our facilities, only computers and internet.
Andrea, would you like to add anything?
Just to give an example, before the COVID, we have in my office 2 specific rooms to see patients by telemedicine. So we have a big screen TV in one room specifically with a camera, and in the other side where the patient is in other office, there is a nurse staff to seeing the patient and discuss with us what the nurse staff is seeing and showing the image through the TV. So for sure it's what we were doing before. For sure now, with all this changing, I don't need more that space. Imagine how is that? I only need a specific space where I'm gonna be there for my computer and nothing else. So I think it's gonna be very, very good for us and for all the developing that's happening in the hospital too. As Rachel said, maybe the best approach, because we're gonna have more space to help people, and maybe we're gonna lose less money too. You know what I mean? With the clouds and everything that's coming, it's just like we are gonna burn all the papers and disappear with them. And we have our spaces now. We don't have a lot of
storage, the archives, right?
Yes, everything,
library,
because everything should be put in one place.
Yeah.
But if you everything burn at some point, you lose all the information. Once you are in the cloud, it's there, the information. You just need to make environment safe. That's the thing.
Yes. Can I compliment Andrea, because you said something very important. If we think about costs, nowadays in Brazil, for example, this implementation that we did in a cloud-based in a hospital in São Paulo, the monthly cost that the hospital is paying for the maintenance and implementation is the same cost they were spending for paper use during the month. So they are not going to use paper anymore, and they are just paying us with their costs, the monthly costs with paper. So it's something that is not so expensive. It's possible to do it. And they are going to invest maybe 70% less than traditional EHR because of all the teams that are involved in an inside implementation.
Yeah, that's really amazing. So like when it's talking about like we don't need much of the hospitals, there's another question here. So what are the soft skills then that this new doctor, the new telemedicine doctors need to be able to offer? Is there any different skills that you need to see patients through telemedicine?
I don't think so. I think it's just a question of timing and learning curve. Once you are in the system and learning how to deal with, it's not going to be a big deal for us. I believe it's the computer, phones, and iPad, they are in our life. All these things are there. It's just a question of time for you to learn how to use the system and use it. And as I'm seeing now, I'm seeing a program now for my own office. Okay, I'm seeing different ones, and all platforms, they're so helpful, and things that we need to assess in your brain before we don't need anymore. So maybe it's gonna be easier to do medicine in the future even, because like I'm gonna do a prescription, the interaction that I'm gonna do with other medications that patient possibly has allergy, I need to assess my brain. But once I have the computer and they just add that, oh, the patient has allergy to that, if I try to prescribe a medication that causes the same issue, it's just gonna blink there in the image, oh, don't prescribe that, because the patient doesn't have a reaction. You know what I mean? That's a really good asset, just to show one example how the technology can be very helpful for us. Maybe turn safer even.
I agree totally with you. And if you think that even if you are the smartest doctor with your huge memory, you cannot remember all the protocols and information
For
and
sure
new
not.
medicines and everything that the world is doing now. With artificial intelligence, we can also access information and new protocols that are doing all over the world and can help you to access in a fast way this information and make your own decision. You might follow that advices or not. The independence of the doctor will be maintained, but you can see all this information in a very fast way. So I don't see soft skills, different soft skills. What I see is that you can use and access in an agile way the information that you need and much more.
In the past, I used to hear from my old professors that there was nothing in medicine that could substitute like physical examination, and it's not true now. It's not true. Physical examination is still a important part of our exam. But in fact, what we have now is like CT scans, PET scans, MRIs, and all kind of blood tests and technologies that are much more helpful. So do medicine, it's now, it's in a point of view, it's even easier because you can see more than what is really happened than before. You know, have a lot of knowledge that was accumulated, but at the same time you have this technology like Rachel and Andrea told that it's gonna are helping us. So no, I don't think it's a huge obstacle to do telemedicine. I think it's no different for us. It's even, you know, sometimes just the contact with the patients, but something you're gonna lost.
So we're completely out of time right now because this discussion is so interesting. I have one last question for all of you, and if we try to keep short. All Brazilians living in Canada, we understand similarities between Brazil and Canada in terms of universal health, SUS, and Health Canada. But we know that Canada is a little bit more advanced in terms of telemedicine and how they've been using telehealth. But what can Brazil learn from Canada, and what can Canada learn from Brazil? And do you see any opportunities for exchanges and collaborations? Like, quick, I'll start with André.
Well, to be quicker, I believe I believe Canada has a huge program, okay, of medicine, and as the NHS in England is one of the best in the world, but on the other hand, some people only have access to the high tech and other things when you're living in big cities in Canada. But that's what happened when you have a system that should be equal for everybody. In Brazil, on the other hand, if you have money, you have the best of the world in terms of medicine. But we don't have access for simple things sometimes in the public system in Brazil. So that's a huge change of values. But again, pass through all the cultural background that we have, because the rich people in Brazil doesn't have the same treatment as the poor people in Brazil. But in Canada, on the other hand, the rich people access the same medicine as the poor people, and they all have the same kind of approach through the doctors. So it's a cultural change for sure, and Brazil needs to change their mind and the way they see the doctor too. And the doctor needs to change the way they see the patient too in Brazil. That's what I see.
Omar?
Yeah, I completely agree. In a general fashion, you know, for Brazilians, if you have money, it's okay. And if you don't have it, it's a huge problem, the health system. And in Canada, even if Canadians complain about a lot of the health systems, and one of the issues, it's always the time, the long time, and other things. You know, everyone has access to it, so it's something that Brazil can ameliorate, can be better on this. for telehealth, I think there is some opportunity in Brazil, and I think for distant regions, they should begin to see it with seriously, and it could really help people from the distance places in Brazil. So it could be a good thing.
I agree with both of you. One thing that is interesting in Canada is the community health think of doing health. So you prescribe less exams, for example, just urgent ones, but at the same time you are thinking about all the community. It's a different thought. And one thing that I've learned here in Canada is these clusters of research and development in health. At Mars, we are there in the test bed area, and they have a healthcare cluster that are doing research together and helping universities and hospitals to discover new things. This union with tech and startups and universities and hospitals is something that here is giant. Is maybe the second one in the world, and this I think Brazil can learn. But at the same time, SUS is a reference in the world if you think about the idea of the program. So both of the countries have a lot to learn and collaborate. If you think about the future, if we could share and learn with both of them in other countries, I think it will be a better world.
This is great. So we have one last question. Sorry, people keep pushing, keep sending their questions. There's one here that got lost into the chat room. So coronavirus and COVID is exposing failures of healthcare systems all over the world. So in terms of the Canadian healthcare system, what is, in your opinion, the greatest strength that you believe we have now in the future? Technology or collaboration?
Can I start with that?
Yeah.
So in terms of Canada, I think the major thing is because it's a full system, a full public system. It's way easier to make people understand and get connect with the same mind idea when you have all the doctors working the same way, or at least in the same system. The problems they all have their own system. They work like a federalist place. So each province has their own ideas, but the system per se is always the same. They all work in the same way in the same site. So people who work in Toronto, they basically do the same kind of job that we do here with the same rules, even if they work for different medical groups. It's the same in Quebec, or it's the same in Newfoundland, or it's the same everywhere. So that's make a huge, huge difference. And that's what makes us act so fast. The big burden that happened in US, it was because of the systems that are all private. How are you going to say that for owner of the hospital? Look, you're going to close your hospital now. You're going to stop to do private surgeries, and we want to see public system public people come for your ICU. So it's hard to make them understand how important they are for the population by that moment specifically, and they get late in the answer. So Canada make a big answer on all this, and that's why maybe we are advanced when you have a public system. So that's why it's nice to be in the public health system in Canada.
It's about the collective, not the individual, right?
Yes, exactly.
It's easier to work together. It's easier to make the same rules for all the places. But we are struggling with many issues, like when to begin again, when to come back. And Montreal, it's really hard at this point because we have a lot of cases, and it's gonna be tough, and we're gonna have more cases. But we have like a very strong system. So we have like in all province of Quebec, we have like 700 USI bed. So, you know, and you are like 200 patients now. So you have a lot of places yet, but it can be very fast. You can like completely put all patients in the ESI, so you have to take care of it.
Thank you. So again, we're completely out of time. I think the discussion went a little bit 25 minutes over, but I would like to thank you so much, Andrea, Omar, and Raquel, our panelists here today, for your time and availability to join us here today. Omar and Andrea, congratulations, and I hope you all stay safe in the front lines. Thank you for all the work that you've been doing in Canada. I would like also to thank our annual sponsors, Vale, Votorantim, Cement, Landing Mining, and Brookfield, for their support and for making those webinars free possible. Please, we hope the information that we shared here today was very fruitful and relevant for your business. Please keep engaging with the BCCC, download our app, follow us on social media to stay informed of our activities and events. You can find us at breastcanchamber.org or go to our website and like on our website or social media. Thank you again for being here. Have a great evening. I hope you all stay healthy, stay safe, stay home. Andrea and Omar, please stay healthy. And thank you again for all your hard work in the front lines of COVID in Canada. I really appreciate it.
Thank you.
Thank you so much, Carolina. Please, anyone that needs any information that we could help, be in touch. I think our contacts are with BCCC. It was a pleasure to share this information with you and be in this amazing team, Andrea and Omar. Big thanks to accept our invitation. It was really, really important to share all this information in our discussion.
Thank you very much. And thank you for the presence of everybody.
Thank you. And if you need to reach Achimus, their website is www.achimus.com, or please connect with me and I'll connect you all with Raquel as well. Thank you so much, everyone. Have a great evening. Thank you.
Thank you. Thank you very much.
Thank you. Bye-bye.
Bye.